In announcing level 1 of the lockdown, President Cyril Ramaphosa said healthcare facilities now have the capacity to conduct tests on any person who may have the virus. He also said South Africa seems to have passed the peak of infections and that hospitals can care for the possible influx of cases. Is this the case? Well, to discuss this, we're joined by Dr Kgosi Letlape, the President of the Health Professionals Council of South Africa, or the HPCSA. Dr. Letlape, always a pleasure having you. Thank you very, very much for joining us.
Good morning, Leanne. Good morning to the viewers.
So obviously a big announcement coming this week from our president, South Africa moving down to level 1 of the lockdown, which basically means that the country is opening up and that things are looking better. How are you feeling about the status of coronavirus in South Africa?
Well, at a personal level, as a person that's over 60 with a comorbidity, I'm still careful. I still listen to what the minister said. I've not been back to work as yet. And now that we're going to level 1, I'm making preparations to get back to my rooms to see patients.
Yeah.
But there's also the calamity of what happened 2 days ago that makes me concerned about going back to practice.
And I want to focus a little bit on that. I want to sort of get the topic of where we are at with regard to coronavirus and the effect on health professionals. And then I want to spend a bit of time talking about the incident that did happen to the anaesthetist, Dr. Abdullah Munshi, a little bit later on in the interview. So I'm certainly not ignoring that. It's a major focus of our interview. But with staying on the topic of COVID-19 and health professionals that have been affected by the pandemic. Talk to us about this. I mean, yesterday the health minister held a minute of silence to respect healthcare workers, saying that 32,000, I'm just reading the numbers, 429 healthcare workers contracted the virus and that 257 have died. Let's talk about this and the role of healthcare workers throughout this period that we've gone through.
I think it's very difficult when you have people that have dedicated their lives to saving society sitting in the front lines, and you are in a situation where you think more could be done to ensure that the environment for practicing is safer, both for patients and the frontline health workers. The fact that we've had to be mired in a PPE scandal is something that was a very sad day for us as South Africans. And I'm hoping that as we get into level 1, we see what happens elsewhere, that people are having new waves. Spain has had 100,000 new cases in the last week. So you see second waves. So we need to prepare for the second wave. And I hope that all that we have learned in this first phase will then be applied. What we're hoping to see is central procurement, ensuring that there's a central way of ensuring that the quality of the PPE is correct, the levels of PPE that are provided are appropriate for the level of care that is occurring, and that we do not have this price racketeering, that the state moves in to ensure that just like we have ARVs and we have the strongest program in the world, we are also able to negotiate and pay a fair price and have good quality pharmaceuticals that are available to people living with HIV. We have to act as a nation so that we can maximize on the resources that we have. And I hope there will be a far better national response to this pandemic so that we can do better as South Africans. If there was central negotiations, I'm not saying all PPEs should deliver to one point, but all the negotiations to come from the center. There's absolutely no reason why one place should pay 50 rands for a mask and another 25 rands and another 100 rands. We should also ensure that this tendering and racketeering around that stops. I think we should use COVID as an opportunity to correct the many wrongs in our society. We need to ensure that in the period that we have, we stock up on adequate test kits. If we get to a second wave, we should be able to test wherever it is necessary to test. We should be preparing the health workforce. There should be greater engagement with private practitioners so that people can access healthcare close to where they live, so they do not have the situations of having to be in public transport for a long time to access care. This is the time to begin to sort out all the issues, including access to services, public transport, and all those issues, the issues of what do we do in areas that are overcrowded. We should be planning to put isolation facilities where people live, not in the conference centers in the cities or in huge places like Nazareth.
Yeah.
This is an opportunity to do much, much more to build the resilience of the health system.
Well, that's
a lot has been achieved, but there's much, much more that we need to do.
There certainly is, and we're seeing some countries, as you rightfully mention, that have had the second wave, and we've been warned that a second wave could be bigger than the first wave. I mean, I was just looking at some of the figures that were coming out of France just yesterday. They recorded their single biggest daily increase since the start of this pandemic. So, you know, we are not out of the woods. I mean, we really do, as you're saying, need to take this opportunity to once again sort out the medical system, make sure that we are ready. But at the same time, there are also a lot of other factors we need to keep into consideration, is that a lot of people have been ignoring other health issues. And these other health issues, because they've been too scared to go into hospitals and seek medical attention, have sort of gotten worse. So I imagine you're also urging South Africans to go out there, don't ignore the symptoms that you have, that you've always previously had, and go and sort these things out. I mean, I'm talking about your usual examinations, also your medication for HIV and AIDS, if you need to go for your testing and whatever it may be. That has also been highlighted as a big issue.
Yes, that is a big issue. And, you know, there are things that we could do. We should be utilizing general practitioners much, much more in our healthcare system. They should be the gateway for patients, even for management of chronic illnesses. If all of us were attached to a general practitioner, that would be your port of call in terms of your healthcare needs. So even if you have chronic conditions, they would not be neglected. We have turned the healthcare system into being too hospice-centric. People have to be going to hospital to collect their chronic medications. They should be going to clinics. They should be going to general practitioners' rooms. They should be going to primary healthcare facilities that are managed by other healthcare practitioners, primary healthcare nurses, etc. We have a lot of resources in our country, and we need to utilize all of them. I hope we should have learned about the evilness of the public-private dichotomy in our country. Citizens should be able to access healthcare facilities wherever they lie. And the state, in accordance with Section 27 of our Constitution, should ensure that all of us have access to the care that we need, not based on the size of our wallet. So we have tremendous opportunities. There's a lot of talk, but there's very little movement.
Yeah.
Now, one of the other issues that is extremely concerning, Leah, is that we do 1-minute ovations for healthcare frontline workers and healthcare professionals. We hoot, we do all sorts of things. We might even do the Jerusalem dance. But that is not how we take care of people. We need to ensure that the working environment is conducive and it's safe. We've had negotiations, or unions have had negotiations with the state. There are promises that have been given about modest increases in salaries. It is a travesty for the state to be reneging on those responsibilities. We cannot pretend we care about healthcare workers and we then renege on agreements that have been made.
Yeah.
There are all these issues about assistance to other people, assistance to businesses, a business fund. But healthcare workers are taken advantage of by the state and by the people of South Africa.
It's a bold
time.
statement.
It is time
Yeah.
that we are shown the love and care by the people of South Africa and by the state.
Yeah, I mean, you talk about the hooting and the vuvuzelas and all of that. I've noticed that stopped. I mean, that doesn't even happen. So we really do need to pay even more respect to our healthcare workers. And I think one way of doing it is to be very, very vigilant, because this has gone nowhere. I want to wrap up this discussion because I want to move on to the incident that happened this week, and it's been a real blight on the health industry, the gunning down of anaesthetist Dr. Abdullah Munshi. Dr. Munshi seems to have been killed. This is what it's looking like. Investigations obviously are still underway right now in what looks like an attack. Nothing was taken. He was gunned down. We know that there were cases against him in the death of children. Let's talk to this. What is going on in this particular case? And I imagine you want to address this particular incident.
What is going on in this particular case and what concerns us as council is the fact that the medical profession is being trivialized by society, but far more significantly by the authorities, the legal authorities. There are procedures in terms of how to deal with procedural deaths, which would be a patient demising while undergoing a medical procedure. We have a Medical Inquest Act of 1952 or 1959, which is the legal process to process these matters. Now, instead of following the laws of the country, the people that are supposed to uphold the law have become vigilantes on the medical profession, criminalizing the practice of medicine. That is what concerns us. In December last year, we had colleagues paraded as criminals, handcuffed, shown all over the media for acts, for professional acts. And this could happen to any one of us. It's a sad day. And when that happened, we wrote, as the Health Professions Council, to the Commissioner of Police and to the NPA. We haven't had a response to that. We copied the Minister of Justice, the Minister of Police, and the Minister of Health. And I have kept the Minister of Health informed. To date, we've never had any responses. 2 weeks ago, one of the practitioners called me because they were still being hauled in court. They were still being expected to make plea agreements, and they wanted to be treated in accordance with the laws of the country so that they are not exceptionalized for whatever reason, and we concerned about the profession being criminalized.
Okay.
That is the biggest issue. Now you see, Leah, once you
Letlape, let me I just want to interrupt you and ask. Sorry.
Vulnerable to what happened to Dr. Munshi.
Okay, Dr. Letlape, I just want to ask you some questions because we are heading into the news time. So there have been a lot of allegations thrown at at your organization as well, saying that that you had almost taken Dr. Munshi and already treated him like a criminal without investigations being finalized. Some doctors who really do not want to speak out, they want to remain anonymous just in case, obviously, that they will be, looked down upon by the council as well. But that you as an organization, the HPCSA, worked with the NPA against the doctors before finalizing any investigation, that the doctor was arrested before anything was ever proven against him. He was suspended before anything was ever proven against him. Why did you take this action as a council against him? Because it seems as though you almost fueled this particular case to make him look guilty before anything was finalized.
Nothing that has just been said is based on fact. It is devoid of any truth. People are entitled to their opinions. And as South Africans, they can even create their own stories. As I've told you, Leanne, we strongly objected to the criminalization of professional acts. We are not colluding with the NPA. We want the NPA and the police to account for treating us like criminals. I can show you the letters that we wrote in December. How could we write those letters and be aggrieved and asked to be treated as professionals and then be accused of colluding with the NPA? Now, people are entitled to their own opinion, but they cannot make up facts. The facts will prove that we've acted in accordance with our mandate. And we repeatedly say to the NPA, there's the Inquest Act that should be used, and there are remedies that can be followed in terms of what is in the Health Professions Councils Act. For your information, Leah, a complaint was received from the family through their legal representatives. And we did what we do in terms of following a complaint. With respect to Professor Bill, as is provided in our statutes, it was considered appropriate to have a suspension hearing for both practitioners, as the family is entitled to justice and we are entitled to get answers from practitioners if complaints are lodged against them. Now, we started those processes in accordance with the law, and anyone that says we should not do that does not understand the responsibilities that go with the privilege of self-regulation. We are a statutory body, and we have to act to protect both the public and the profession, so that this type of acts where we are tending to criminals are not allowed. Everything that is being said is devoid of truth. And let me tell you what happened. In the processes that we have, there was a suspension hearing in accordance with the rules. And Prof. Bill was represented. There was a hearing. He was suspended. The same process was followed for Dr. Munchi. Unfortunately, the family then objected and wanted to prosecute Dr. Munchi themselves. They wanted to be the ones that are complainant, judge, and jury. And we objected to that. So the process of the suspension hearing of Dr. Munchi could not be proceeded with because of outside legal interference. We then proceeded to continue in accordance with our act, and the matter was prepared and being referred to a preliminary committee of inquiry in accordance with the provisions of the act. So there's nothing where we're cooperating with the NPA. There is nothing where we're acting unprofessionally. We're doing our duty with the utmost respect to complainants and with the utmost respect to practitioners to whom complaints have been lodged.
Just finally and very quickly, it's a last question. I need a clarification from you, because there is an article that's come out today where doctors have been quoted, and this is in the Daily Maverick, I'm reading it right now, where they're saying that multiple doctors again have come out and said that the HPCSA had actually exonerated both doctors. Is this true? Did that actually happen?
That is not correct. As I said, Leanne, with Professor Bill, there was a suspension hearing, and the matter is being taken to conduct inquiry. The matter has not set. With Dr. Munchi, the matter was being referred to preliminary inquiry. The matter has not set. We have legal vigilantism from the state, treating us as criminals, taking the matter to the criminal courts. That is what is happening. And all that information about post-mortem reports, those are issues that have not come to us. The investigators will get the relevant reports for the relevant hearings. And that would include post-mortem reports in a matter that includes the death of a patient. But in terms of our processes, nothing has been concluded. the matters were still being investigated and they were still coming up for hearings, as are the provisions in the Health Professions Act of 1970.
Dr. Letlape, we have to leave it there. Thank you very, very much for your time and for talking to us here on a range of issues this morning. That, of course, is Dr. Kgosi Letlape. He is the president of the Health Professions Council of South Africa, talking to us about that anaesthetist, Dr. Abdullah Munshi, who has gunned down. Investigations are still ongoing into his death and the events surrounding it, and of course the country moving to level 1 from Monday. Let's get our news just gone.